Um, Hi, Dr. Murat Gokden is a professor of pathology in the Department of Pathology at UAMS. He is board certified in AP, NP, and cytopathology and has practiced in medical school, College of Medicine setting for 25 years, practicing all aspects of pathology in his earlier years, but exclusively NP for over 15 years. He has published and collaborated extensively, taught a variety of learners, mainly medical students and trainees of pathology and other related specialties. Dr. Gotkin is also actively involved in the AANP and USCAP in a variety of capacities. Dr. Stephen Nix is an assistant professor of pathology in the Department of Medical Education at Alice L. Walton School of Medicine and an independent consultant for neuropathology, head and neck pathology, and eye pathology with Northwest Arkansas Pathology Associates, a private practice. He is board certified in AP/NP and has special interests in pathology education and the health humanities. And I'm really looking forward to this talk.
Okay, hello everyone, and thank you, Dr. Oviedo, for this kind introduction. Yes, no matter how good we are as a neuropathologist with board certifications and possibly with additional qualifications, there are still a lot of things that are not in the books. So we all have been there. We get a job, usually start working at a new place among people that we are not completely familiar with. And probably they have an established system, likely a little bit different than how we were trained. So things can get pretty confusing. So Stephen and I decided to provide some pointers and bring some awareness to particular issues that may arise for the new neuropathologist, although these are applicable to any pathologist getting a new job. Obviously, we will be focusing on neuropathology. So this idea came to us after combining our experiences and after a lot of chats at UAMS. If this ever becomes a movie in the future, one of the initial scenes will say, inspired by a true story. But I have to mention that any characters are fictional and any similarities are purely coincidental. So we intend to do is I will go over some general issues and pointers, and then Stephen will, in the second half, dive deeper into select ones that are probably more applicable to most people. We don't have any financial disclosures. Learning objectives, I think all of what we will be talking about is important, and much of it is probably very new to a junior faculty member, but these are the few main points that we would like to especially emphasize as they are more applicable to most people. So if there are especially trainees who are already locked in for a new job or starting to look for one, they should probably keep these in mind, and especially the last one, the expectations from a career is particularly important in my opinion, because that requires a lot of soul searching and reflection and self-awareness. So they probably need to start thinking about how they would like to see themselves in the next 10 years. Also at the end, obviously, we will have a Q&A session, but we really appreciate, I don't know how many trainees will actually be participating in this, but I'm sure there are a lot of experienced neuropathologists in various settings. So we really appreciate any kind of feedback and bring to our attention certain things that we may have not considered. That way we can put this together better because we are going to also present a luncheon talk, trainee luncheon at the AANP with participations from Dr. Bill McDonald as a private practice pathologist, neuropathologist, and also Dr. Steve Carroll, who was the department chair as a neuropathologist at the Medical University of South Carolina until last year, so that they can give us their perspectives. An outline is not comprehensive, obviously, but these are the main topics we will touch on between Stephen and I, and some of them in more depth than others. But before going into any of these, I think especially important is the academic tracks and promotion and tenure process, since most of us are in academic setting. And before going into any of that, the most important thing in my opinion is to have a mentor. So mentor, coach, advisor, whatever you would like to call it, but this person needs to be someone, regardless of their age, but with some seniority on the job, preferably at the same institution, who knows the ins and outs of the department and institution, so that they can guide you with certain things. Obviously, mentors can tell you a lot of things, but they cannot tell you what to do, and they should not. I think their main function is to bring things to your attention so that you can consider them. Their main function is to provide awareness. And obviously, as professional adults, everybody should have the capacity to consider and decide for themselves. I think, the wisest thing an individual can do is to ask and listen, and then consider. And if it works for them, great. If it doesn't, if they think that is not good for them, obviously they can choose not to follow that path. So practice settings in neuropathology, as we all know, most neuropathologists practice in academic setting, and this has been also, this is not simply anecdotal, confirmed by various AANP surveys over the years. But there are some neuropathologists in private practice, and the typical scenario in that context is that they are part of a large pathology group, and their hospital happens to have a large neurosurgery practice, and they're providing a lot of brain tumors, and that's where they come in. Well, unfortunately, in contrast to dermatopathology or hematopathology that are considered relatively heavy volume and more lucrative subspecialties of pathology, neuropathology specimens, no matter how many you get them, will not make up your salary. So these neuropathologists in private practice setting will necessarily have to participate in general surgical pathology as well as taking CP calls. So, and as a downside, maybe, depending on what your views are about your career, you will be limited much of the time to surgical neuropathology, mostly brain tumors, whatever neurosurgeons send you. There are some private practices where people get a lot of muscle biopsies, depending on their contracts, etc. But these are unusual situations. Also, there are large corporate labs, research labs, where people as neuropathologists can function as part of a research group, maybe drug development, experimental studies, things like that. And there are also commercial laboratories that perform a lot of molecular genetic testing, so they can get jobs in those settings. There are also, especially recently, I've been noticing that a double fellowship in neuropathology and forensic pathology with growing interest in forensics. And that is great. There used to be a need for that when I was in residency. There were only a couple of people in the entire country known for that expertise. One thing I noticed personally from my experience that those forensic neuropathologists typically are housed in the crime lab or medical examiner's office. And obviously they like that. They do the fellowship, and that's great. But over time, it turns out that they tend to get detached from their main department in College of Medicine. And so and become limited to whatever their forensic expertise is and not seeing other aspects of neuropathology. And there is nothing wrong with that, obviously, but unless you had other plans for yourself. So that's another thing that may be worth keeping in mind as an example. There are different job scenarios, and I'm sure we have all seen the examples of those. Most people would like to practice neuropathology only, and they do, but it is slowly becoming a thing of the past. Now, a lot of junior neuropathologists are expected to cover something else, and that usually happens to be a surgical pathology subspecialty, or a combination of that with autopsy, obviously frozen colds in general pathology, and there may be some directorship opportunities as well, such as autopsy or laboratory directorships. And also another point to keep in mind is whether you will be practicing solo, two neuropathologists in your institution, or are you going to be part of a larger neuropathology division with multiple people with expertise in different areas. So that is important because, you know, that brings up the issue of how prepared you are to handle all aspects of neuropathology. And a lot of times, training programs may be, I don't want to say deficient, but maybe a little behind in some aspects of neuropathology training. And that has to do with a lot to do with faculty availability and logistics. And they may end up sending their trainees for instance, a couple of weeks to another institution or another department. One prominent example of that would be, for instance, muscle biopsies. So that may be handled by neurology division, and you go there, do your 2 week of muscle rotation, and unless you develop a special interest to it, you won't worry about it until your board exam time. But that may be a problem if your job requires you to cover a lot of muscle biopsy. And if you haven't seen an electron microscope or looked at an image, electron microscopic image, you will have a lot of difficulty adjusting to that. The same can be said for pediatric tumors and pediatric neuropathology. If you haven't been exposed to that, and now your job requires you to cover children's hospital, then there will be some additional work to do. So probably depending on your job prospects, it may be a good idea to spend extra time in those areas to brush up your skills in preparation of your new job. Well, this is highly variable, I'm sure, but this is an example of academic tracts and their responsibilities. I got from the UAMS Faculty Affairs website, where they have a document for promotion and tenure. Promotion and tenure are separate concepts, but in most places they will go hand in hand. But the main thing to note here is that there is a basic scientist track and a clinical track, and each of them has a tenure pathway and non-tenure pathway. Basic scientists are pretty straightforward to describe. They're the lab researchers. They have grants. They do their research, and they unless they have special interest, they don't really have to do anything else, as long as they keep their grant funds and continue their research. Clinical track has a scientist and educator pathway. Clinical scientist is, in my opinion, the hardest because you're expected to be show some excellence in both clinical arena and as a scientist, as a researcher, and even get some small grants, if not NIH funding. Whereas clinical educator track is probably what most of us do or end up doing, and that is patient care and training of our students and residents. There is also a clinical attending pathway, which is not tenure eligible. And that is basically a clinical heavy, diagnostic heavy, day-to-day blue collar work. And unless they want to, they don't have to do additional things, for instance, publications, etc. They can still go up for promotion. And they can do lab directorships and other clinical services. So that brings us to what is tenure. Tenure is, according to American Association of University Professors, and I will read from here, a tenured appointment is an indefinite appointment that can be terminated only for cause or under extraordinary circumstances such as financial exigency and program discontinuation. So tenure is put there with the principal purpose of to safeguard academic freedom, because that is necessary for all who teach and conduct research in higher education. When faculty members lose their positions because of their speech, publication, or research funding, they cannot properly fulfill their core responsibilities to advance and transmit knowledge. Now, tenure is not really a lifesaver as it is advertised, because it is not like you can do whatever you want because you're tenured. It is more of a, in current practice, in my opinion, more of a honorary thing, because it shows your institution's commitment to you, that they like you, they want to keep you, unless you want to leave on your own. So that is nice to know. But if they really want to get rid of you, yes, they cannot fire you right away, but they will probably find a way to make your life miserable, and you will end up leaving anyway. Of course, we don't want to see that happen, and that's a very rare situation. And then there is this most recent example, I think it was yesterday on the news, that the Harvard professor was stripped of her tenure because there were some ethical issues in her work. And coincidentally, she happened to be a professor in ethics department. So I found that pretty funny, but I don't know the details, obviously, other than what was on the news. So that is all about tenure. I think the bottom line is tenure for me is something of an honorary thing, an honorary title that is good to have, but it comes with certain requirements as well. For instance, there is something called the tenure clock that is 7 years at UAMS at my institution. And if you cannot get promoted and get your tenure in 7 years, you have to leave. For that reason, many institutions will start you as an instructor before putting you on tenured academic track as a trial period to see if you can really handle the stress and do your duties in time, publish, and other requirements. And then they will transfer you to an academic track to go for tenure. There is also a situation where you may start with a non-tenure area or track, and you have 3 months if you decide to switch back onto tenure track. And if you do not do that in 3 years, you cannot do that anymore at that same institution. Okay, so in promotion and tenure, Stephen will talk a little bit more in detail about that. But what I want to mention briefly here is that there are these four main buckets of clinical service, teaching, research, and administration. And people are expected to be excellent in one main area and somewhat of a, somewhat good in a secondary area of expertise, let's say. And so, for instance, in a clinical educator track, that will be you're an excellent clinician. You do a lot of service and take care of your lab responsibilities and also do a lot of teaching, possibly getting some good evaluations from the students and maybe even some awards, teaching awards, and that's how it works. But regardless of your track and whatever you're trying to accomplish, in promotion and tenure process, there are also additional things that everybody should be doing. And those are the professional recognition and service to your department and institution and your community. Um, so those are like general things that we don't really think of our duties, but we end up doing them whether we want them or not. There is also something called a secondary appointment. You will see sometimes that if somebody's title will read as Assistant Professor of Pathology and Neurosurgery. So there is no financial incentive from that secondary department, but that is given as an honorary title to you in recognition of your significant contribution to their either research or teaching or significant involvement in their operations somehow because of your subspecialty. Uh, and so that's nice. While applying for promotion, however, remember that one has to apply separately from that secondary department. And it's not a huge deal. It's just getting the support of the secondary department's chair with a support letter. Otherwise, you may end up, if nobody tells you, you just go up for promotion from your pathology department. You may end up as associate professor of pathology and assistant professor of neurosurgery, which is fine. It's just more complicated. So publications obviously is a huge part of academic medicine and academic anything pretty much. Scholarly work is the foundation, and it has multiple purposes. And Dr. Oviedo a while back had a great talk here at the teaching grounds about publications. So if you're interested, you might want to review that in retrospect. But in addition to contributions to the literature, sharing your experiences with others, educating yourself and others in the process, and getting your name recognized as an expert, and developing a niche of expertise, if you will, if you keep publishing and investigating certain areas, those are some advantages. There are a lot of options to publish that Stephen will also talk about a little bit. But doing some little projects, even if case reports, will allow you to go to meetings and presenting, and these are nice experiences that in turn provides opportunities for networking and involvement in your professional society, and gives you some recognition. And besides, we have unwritten duties to our specialty and subspecialty, and we should be doing these activities to advance our specialty. There is always this debate on, if it is not really original or first example of whatever, is it worth publishing it, or is it even worth trying? And what is it good for? Well, yes, I think it is worth trying and publishing, because I personally remember getting help from multiple studies on one subject uh, showing me different aspects of the process when I have a difficult case. Even case reports, I find an example of the same situation. I feel better about it, and I can cite it, and I can support my views. And so these are uh, additional advantages of getting things out there. There are a lot of things that, we do not factor in our daily planning. So we think that, oh, okay, I'll go to work and I'll sign out these cases and maybe read a little bit, and then there is this conference, and that's about it. But unfortunately, there are little things that show up out of nowhere and throw us off. I can't tell you how many times I came to work like, okay, there are these 5 cases I need to finish. Their molecular results are out. I'll finish them and then start working on that paper. But turns out that I couldn't even get to the cases to start with. So some examples would be like, for instance, your colleague will come and say, hey, I have an emergency. Can you cover frozens for this morning? Or clinicians will show up at your door out of nowhere. Hey, can we review this muscle biopsy? This patient is interesting, or whatever the case may be. Or your chair will give you some assignment saying that, hey, can you, investigate this problem we have in our department, maybe do a survey and report results in our next faculty meeting. Now, what are you going to do? So these are additional things that we need to probably factor um, in our schedules. Unfortunately, they're unforeseen circumstances. There are, of course, friendships and collegiality and interactions. What if, neurology department asks you to interview this candidate or 3 candidates for their neuro-oncology position that they're recruiting? And that probably gives you a lot of recognition as well on campus and makes you feel involved. And you are involved, of course. In some institutions, neuropathology is somewhat isolated, maybe in another building or another floor, and you're doing your own thing and may not be feeling like a part of the general pathology department and feel a little bit detached. So these are the things that will also help you uh, continue your connections and involvement in your department and institution. Now, investing, when we hear about investments, of course, we're talking about, we always think about finances, but I think investing in your professional future is also very important and follows the same principles, just showing up every day and building your professional portfolio little by little. Not everything or even every year will be extremely successful or great for you, but one week you may be focusing on that paper, and another month you may be focusing on that talk preparation. But you have to be doing something every day rather than cruising your day through your day unconsciously. There is also something called work and life balance that I don't fully understand, but it seems to be very popular. And apparently, if the balance is tilted towards work too much, it can lead to a condition known as burnout. So please investigate information and resources in your institution regarding well-being, faculty well-being, health, and some activities. There are extremes of life is life and work is work. They should be separated. And then there is what I call a fluid system. And you can find a brief paragraph on the internet if you search Mastering the Art of Living or In the Art of Life, where you should be enjoying both parts and you can do whatever feels right for you. There are, of course, resiliency and handling problems. There are counseling resources in the institutions now. And also there is the 3 principles of enjoying your work. And that has been presented in a book by Daniel Pink as mastery, autonomy, and purpose. You need to probably be a master of your work as much as possible so that you feel comfortable and you understand what you're doing rather than sneaking in the hallways. Having some autonomy in your work, being able to do your research and reading is also important. And of course, if we know why we're doing things like a higher purpose and serving somebody other than yourself are also additional perks that will support your enthusiasm. There are other considerations that I don't really fully understand even after all these years, but that they are basically administrative jargon, but you have to kind of pay attention to your, while starting your job, your fringe benefits, for instance, how much money will department will give you to go to meetings or CME credits, or even pay maybe your state license renewals, pay attention to retirement plans. Doctors are terrible. Everybody tells that, even though they get good money, they're not cognizant of the fact that they have to save and they find themselves in trouble in the future. So these are things that additional considerations that we need to worry about. Anyway, I know I took too much. I'm sorry. Now I will turn it over to Stephen for a more entertaining and colorful component, or the second component of this talk. And thank you very much for your attention. And we'll do the Q&A at the end.
Well, thank you very much, Murat. I hope everyone can see my screen now. In this part of the talk, we'll talk about some practical aspects that I kind of wish I would have known when I was starting out as a newly minted neuropathologist, and a couple of tips and things in a broad overview. But ultimately, the success in your new job is going to start with the job hunt. Some of you may already be looking for jobs, and it's ideal to start looking about 1 to 2 years before your start date. In addition to thinking about those geographic preferences, ask your mentors, ask the pathologists at your institution, and ask recent graduates about job leads or how they liked working in different places. And AANP has a great job board as well as pathology outlines. When you're thinking about your job, it is helpful to start kind of soul searching a little bit. Think about, what are your interests, motivation, and goals? What are your values? Do you have a very particular research interest that you need to be someplace that has a certain type of lab setup? Are you drawn into private practice or academic life? Do you see yourself in leadership later on? I've copy pasted Schwartz's values. Now, all of these might not be relevant to neuropathology, such as hedonism here, but there are different tests and things you can do online to kind of find out a little bit about what your values are. For example, let's say that you really value self-direction, novelty. A job that is very conservative, that still signs out things as pituitary adenoma, might not be the best fit for you. And by knowing your values, you can compare that to the institution that you're applying to. It is important to compromise, as Murat brought up, because there are only so many neuropathology cases. So a lot of newly minted neuropathologists have to pick up an additional skill, such as autopsy, surgical pathology, or leadership. This isn't all bad. For example, I do head and neck pathology, and I really enjoy that aspect of my career. And there might be ways that you can combine neuropathology with other specialties. When you're researching your future employer, think about the faculty, think about potential mentorship opportunities, and what is the academic track record there? Is there an autopsy service? Is there a brain bank? What kind of hospitals are associated? It's important, especially in your junior career, not to limit your clinical skill set unnecessarily. You might not want to take that job that only looks at peripheral nerve biopsies, for example, unless that specifically aligns with your career and research interests. It's better to stay broad if you can. It's also important to know how much you're worth. Though this this price sticker is a little scary at $1,500. Most residents and fellows are going to be a member of the AAMC through their institution. You can download this for $75 and get an idea of what people are making in academic pathology or private practice pathology at different ranks and within different regions. Choosing a job and finding that job is really about balance. You're balancing, will you be a good fit for this job based on your experience, interests, goals, and values? And also, will this job advance your career goals? Are there going to be opportunities for mentorship, research, teaching, and so on? Now, during the interview, I have given a lot of faculty interviews this year, probably close to 30. Um, it's important to go into your interview prepared as well as have some questions that pertain specifically to your interest and goals. Some easy questions are, what kind of neuropathology specimens are there? Is there neuromuscular in eye? Is there neurodegeneration? Is it all surgical neuropathology? What services are you expected to cover? If you need to pick up a new service, will there be on-site training as well as mentorship there? How is call structured? Is it neuropathology only call, or will you be doing general call? And you don't want to ask questions just to ask. Think about those questions and how it's relevant to how you envision your future. Be prepared to discuss specifically why a job is right for you and why you are right for that job. Uh, when I was in fellowship, outside of some geographic considerations, really, I was thinking a lot about, I just need a job. But that's not a good reason for your interview. We really want to have that perfect match, and that will contribute to your success later. Money and benefits are often discussed in later rounds of interviews, so don't open with salary inquiry or vacation. They'll come up. Also, it's generally wise not to throw out your salary expectations. Let your employer give you a salary number that you can discuss. And then while you're interviewing, think about the work environment. What's the turnover like? The promotion tenure, the P&T. Did all of your interviewers show up to the interview? That might be a clue into the work-life balance. What's it like with residents, medical students, and staff? And eventually you'll find that job. You're hired. Things are great. You can't wait. You're picking out a plant for your office. And then the beginning of your new career starts. And I will say those first months as a practicing pathologist can be pretty overwhelming because you're having to do things now that you really didn't think about that much, like CPT codes. You're doing organ transplantation autopsies at 3 a.m., liver transplant, and GI is calling you. They're saying you missed single cell necrosis. Those glial hypercellularity with atypion small biopsies. The resident has somehow forgotten to sample the hippocampus again on an autopsy case. And while you're doing this, you probably still need to take your NP boards. So there is that study component, and you might be thinking to yourself, wait, is there anything else that I'm missing? And if you're in an academic place, there is. You're expected to show excellence in at least some of these facets of research, professional recognition, leadership, administration, service, and teaching. What we don't want to happen is we don't want to get to that point where we're resigning. I always wanted to be a marine biologist when I was growing up, which wasn't great when you're coming from Arkansas. I might write a letter like this, and I'm sure they'll be happy to distribute all of my pending call for the rest of the year. Now, I'm joking right now, but this is actually a big problem in academic medicine today. This study that looked at contracts over 10 years found that 20% of faculty reported intention to leave, and there was a 15% attrition rate among assistant professors, which was significantly higher than full professors. Though it wasn't proven in this study, they hypothesized that the reasons for this attrition rate were inadequate career advancement opportunities, lack of mentoring opportunities, heavy workloads, and refusal of tenure. Now, these top three are the things that you want to assess in the interview before you even take the job. Is this going to be a good fit for you, and are you going to have those opportunities? Refusal of tenure is something that we can plan together to hope that you don't get into this situation. So for the last part of this talk, we'll talk about some general strategies where you can think about how you can be successful in these different facets of your work so that you are promoted, so that you get tenure and that you have a successful career. Let's start with clinical service. Organization is key. And especially when you're starting, and always really, you want to balance efficiency and safety. You're going to take more time on your cases when you're beginning, and you're going to show a lot more cases. You need a good way to keep up with your addendums and amendments. Not every system works for everybody. Just pick something that works for you and stick with it. It's also important to be professional in your transfers and consults. Don't be the person that just sends something to heme without a question. Write a note, have a specific question, and if you're able, I would encourage you to follow up for your own professional development as a pathologist and also to show your appreciation for someone's expertise. I learned a lot of hematopathology in my first couple of years, and now that I'm in private practice, I'm ready to sign out mantle cells and other heme things, for example. Be a team player when you can for call and coverage. Don't overstretch and show up to meetings. Interact within your department. These are all important things to helping you succeed in your culture. It's also important how you interact with professionals outside of the pathology department. We want to cultivate those positive relationships with surgeons and clinicians. Know your surgeons, maybe even exchange numbers. Be available, be at tumor boards. And whenever a surgeon or clinician comes to you with a request, I encourage you not to minimize those concerns. Try to understand why they want a particular test done or why they have a question about your report. See if you can find a way that you can both be happy with the outcome. Be transparent and direct. What does your report mean if you say suggestive of or consistent with? And offer to discuss over the phone if there is a case that is equivocal. Remember, we're all part of the same team. And even though it may not feel that way sometimes in intraoperative consultations, we want what's best for the patient. Building those relationships early are going to go a long way to your success. Now let's take a moment to think about teaching and education. A lot of people in residency and fellowship are very enthusiastic about teaching. Teaching medical students, you get to impart expert knowledge, you get to stimulate critical thinking and inspire those next generation of neuropathologists. But the reality is there are a lot of challenges, such as rigid curricular guidelines. Maybe your institution wants you to just record a lecture and post it, and you don't even get that time with medical students. There's limited time for pathology in general at a lot of institutions, and medical students may be resistant because it's an esoteric subject matter. Well, you may say, okay, well, I've given up on medical students, but at least I'll be able to teach residents and fellows for those same reasons. But there are also similar challenges with residents and fellows. There's limited time for neuropathology, variable interest, and it's a very esoteric subject matter that not everyone is going to be interested in. Additionally, the evaluation of your teaching is mostly based on student evaluation of teaching, which can be influenced by non-academic factors such as low response rates that can favor extremes of feedback. Perceived easy subjects, neuropathology not being one of those, are generally given higher ratings than more difficult subjects. And things like gender bias and attractiveness can influence student evaluations. Now, I don't present this as to say we should give up, that it's too difficult, but to show that there is a challenge in neuropathology and to think about what can we do to make neuropathology delivery better. One way is to think about adult learners. Two things that I think are especially relevant to neuropathology and teaching in medical school is that adult learners need to know why they are learning something and they engage better with problem-focused content. So you might pay a little extra time to doing cases that seem relevant to a medical student or a general practitioner so that they can see why they're learning neuropathology and why this will be useful to them. Another thing that I didn't get a lot of training on is feedback, which is a big part of education. Now, a lot of us have heard about the feedback sandwich, which is where you give a compliment and then there's some kind of corrective criticism and then another compliment. But many people feel this is not the best way to give feedback. because it could be perceived as manipulative or disingenuous, and it might even distract from that intended message. Maybe they don't even hear the meat of that feedback sandwich. One thing that you could even start doing today is to think about feedback in terms of situation, behavior, impact, and actionable suggestions, as well as encouraging two-way feedback, where the student gets to give you some feedback as well as give comments. So for example, a situation, we want to say exactly when it happened today at sign out. Behavior, you didn't provide clinical and radiologic information for your brain tumor cases. Okay, what was the impact? This could have resulted in an incorrect workup and diagnosis, leading to the patient receiving suboptimal care. Now might be a good time to open up the discussion, find out why this behavior wasn't done. Maybe I didn't give clear expectations for my service, for example. And then you might provide an actionable result, such as writing the information on a paperwork. It's also important to give positive feedback. Saying great job, good job, strong work, those don't really tell the resident or student what was good about their work. So you could say today at sign out, behavior, you counted mitoses on every slide and found a mitotic hotspot. What was the impact? This resulted in the correct grade, which will be helpful to the oncology team in selecting the correct treatment. And then what is our actionable suggestion? Keep doing it. Keep being diligent because your work truly makes a difference. Once students know what is helping, that will help guide their behavior in the future for improvement. And they will likely be thankful for that feedback in your evaluation. Research and scholarship. Not all scholarship is created equal in the eyes of the promotion and tenure committee. And I'm checking the time here. Okay, so we got about 15 minutes. I'll go fast at the end so we have some open for discussion. But it's important to your institution to know what counts. Do case reports and review articles count? Do book chapters count? Do I need to think about impact factor? Does your authorship order count? This is all different. And if you need external grant funding for your job, your approach would be very different. People will also approach you because maybe they have an interesting case report and they'd like pictures. This is a great way for collaboration, but you also want to make sure that you're being credited for your intellectual contribution. You made the diagnosis on the case and you can contribute to the case report. However, if someone comes to you and they want you to count mast cells on 200 schwannomas, but they can't include you as an author or pay you, this is not a good use of your time. Don't be afraid to say no, or see if you can seek some kind of compromise that's mutually beneficial. Research in neuropathology often has substantial costs, but you can begin keeping track of interesting cases for a potential series, learn about scientists in your institution, and investigate library resources for scoping reviews. Just because a publication doesn't count for promotion and tenure doesn't mean it's not valuable. These may give you opportunities to work with other professionals in the community, as well as be helpful for pathologists and academics. Try to set one goal for yourself each year, one article that counts, as well as a couple of other efforts. And think about the allotment of your time. If you're submitting an abstract that you don't think could be turned into a manuscript, maybe it's not worthwhile to submitting that abstract to a conference. Leadership, administration, and service. It's important to set expectations. You might not be leading that committee that you wanted to lead during your first year, but you know, maybe that is a goal that you want to work for later. Oftentimes, opportunities aren't evident, so feel free to contact your Faculty Affairs office. You don't need to set up a meeting with the Dean of Faculty Affairs. Anyone in that office will know the current needs of the institution, and there might be ways that you can start on something, because if you can find just one thing that you're a little bit interested in, you're going to build positive working experience. You're going to strengthen the trust in the institution in you, and that will lead to future opportunities, such as that committee that you really wanted to be a part of. Administrators and leaders are always looking for high quality people. If you are interested in future leadership, let people know. That way you can develop a plan for how you might reach those goals in the future. National involvement also counts, such as at the AANP. All of this is funneling into professional recognition. When you go up for your promotion to associate professor, you are likely to need 3 letters from full professors that talk about your contributions to academic medicine. These are people that are outside of your institution and haven't trained or employed you. Everything that you're doing, such as editorial boards, journal peer review, national committees, and collaborative scholarly works, are what are funneling into your professional recognition. So starting these early can only be helpful as you're building toward asking for these 3 letters. Final factors that matter, and we'll go very quickly. Mentorship matters more than anything, I think. I would encourage you to look for a mentor in each of those domains. Have a clinical service mentor, have a teaching mentor, have a service mentor. And if your program doesn't have a formal mentorship, thinking about creating your own mentorship program and meeting regularly. Look for mentors in AANP. These are often way more important than formal training programs. Culture fit matters. We'll go ahead and skip through some of these for time, but try to contribute to a positive and productive work environment. And the culture, that is the values and history of institution, will play very heavily into how you function within an environment. Avoid office politics if you can. They're going to inhibit productivity and other things. And think about your well-being and resilience. Uh, Well-being and avoiding burnout is much more than having snacks in the break room. And though we don't have time for this now, you may consider the AMA steps forward to avoid burnout. There's a QR code here. Notice that get organized and prioritize and schedule is step number 1. Have a plan for your year. This is just an example plan you might have if your allotment looks like this. Plan to have 1 publication, maybe have 2 to 5 didactics or learning experience, and try to be involved in at least 1 national and local committee each year. Finally, document all your efforts. At the end of each year, you will have a performance review, and your life will be much easier if you have a spreadsheet where you've written everything that you've done and why it was meaningful to you and the institution. These past activities are going to lead to your future planning goals and your future success until you are a successful neuropathologist. So concluding thoughts, very briefly, start envisioning your career goals and if those align with your values when choosing a job. Think about mentorship and opportunities, contribute to a positive work environment, and maintain your personal wellness. And planning goes a long way. Here's some further reading, and I will open it up now, I believe, to questions and discussion.
Yes, thank you so much, Dr. Gokden and Dr. Nix. At this time, we'll move into Q&A. You can submit your questions in the chat box or unmute to ask a question. When you submit via the chat box, please make sure you send it to everyone so that everyone can see the question. And to unmute, select the microphone in the lower left corner, and after you've asked your question, please remute. Okay, please go ahead. Anyone that has questions.
Or comments or advice.
I was going to say, I think the best thing I heard was the mentors. That's my opinion.
Yes, that reminds me of a proverb that roughly translates something like this: someone who, or the one who asked went over the mountains, and the one who didn't got lost on a flat piece of land. So I think getting guidance from multiple people to get different perspectives and ideas is very important.
I also recommend sometimes asking an older person and a younger person, someone who's 30 years older than you and someone who's 5 or 10 years ahead of you. It's another recommendation.
Well, I certainly learn a lot from my younger colleagues, such as Stephen. Anybody who comes up with additional items that can be included in this type of presentation that can be useful to our junior colleagues and fellows, please email us so that we can include this in our AANP presentation. I hope that everybody finds the perfect job for themselves.
Can you tell me what day the AANP presentation is, please?
It is on the Saturday. I believe it is the 21st, the trainee luncheon from about 11:30 until 2 o'clock.
Okay, so it's for trainees only.
That is correct.
Okay.
Right,
That would
and
explain
we
why I
should
wasn't
have.
in. Yeah.
Oh, I was going to say during that we'll probably have some more time for some small group discussions, one-on-one discussions, and questions that you might have as you're preparing for those first years in neuropathology.
And I apologize, we went a little bit over time, but I think because this will remain as a review material for future reference, I think it turned out to be a good thing that we said as much as we could, but never complete, of course.
Here's one comment in the chat. Ji Chen says, "Thank you so much for the excellent talk. I wish I had these great advices when I started my job."
Oh, thank you, Dr. Chen. As much as I can see, you're still doing excellent.
Yeah, and we'll never have all the answers going in, and just to stress again, that mentorship, especially in those early weeks and months, having someone that you can talk to about things is worth a lot and really helps you to get on the right track.
Fortunately for all of us, neuropathology is a very family-like environment. And you can see that when you come to our meetings, and some residents who came with me over the years commented on that too, compared to some other subspecialty meetings and general pathology meetings. We seem to be more welcoming and more like a family environment. So I think that makes a lot of difference. Everybody pretty much knows everyone when you start a job, and that makes you feel comfortable.
We have another comment. Shino Magaki, thank you so much for the wonderful talk.
Thank you, Dr. Magaki.
All right, if we don't have any other questions, we'll say thank you again for joining today's AANP Teaching Rounds presentation. We would ask that you take a few minutes to complete a short evaluation. Completion helps ensure accurate reporting to the accreditation board. A link to the evaluation will appear on your Path LMS screen upon the conclusion of the Zoom meeting, or you can navigate back to the main course and select the evaluation option. Once you've completed the evaluation and selected your credit amount, please then select the appropriate certificate based on your credentials. The PowerPoint slides and recording will be posted to the AANP website in the next week. Thank you again to Dr. Gokden and Dr. Nix for an excellent presentation. This concludes the session for today.
Thanks for having us.
Thank you very
Thanks
much.
everyone for attending.
Thank you.
All right.